Well, I'm back again at Star Orthopedics here in Rancho Mirage, and I'm joined with Dr. Raj Sinha. How are you?
I'm great. How are you?
I'm well. Thanks for having us back.
Thanks for coming back.
Yeah, we are in your physical therapy exam room. Is that right?
This is our physical therapy gym. That's correct.
Okay. So I know we're going to talk a bit about partial knee replacements today.
That's right.
Give me some detail. What exactly is that?
Well, if you think about your knee is made of three compartments: the inner side, the outer side. That's between the shin bone and the thigh bone.
Okay.
And then the space underneath the kneecap. That's the third compartment. And when all three compartments go bad, you do a total knee replacement. We do about 1 million of them a year.
Mm-hmm.
But in about 10 to 15% of people, only one of those three compartments goes bad. And sort of the analogy is like a bad tooth. If one tooth is bad, you don't replace all 32 teeth, you
Right.
just replace the one bad tooth. So if only one compartment is bad and the rest of the knee is essentially normal or close to normal, it makes sense to try to just replace the one part.
Mm-hmm.
That's what a partial knee replacement is.
Gotcha. So this gentleman behind us, it's safe to assume that he's had some sort of knee replacement?
He has. He's had 2 knee replacements.
2 knee replacements. Okay.
But in his situation, all 3 compartments were bad, and so we had to do total knee replacements.
And this is obviously part of the physical therapy, the healing process.
Right, so he's actually going to work on strengthening and range of motion, and he's using this machine here to get warmed up before he does the exercises.
Okay, so let's talk about some of the advantages to partial knee replacement.
Well, the biggest advantage is just the fact that it's much less surgery. So there's less risk of infection, less risk of blood loss needing a transfusion. The risk of blood clotting is lower. Patients recover faster. They feel more normal once they're recovered because, let's face it, 2/3 of the knee is the normal knee. And I think because of that, people can get back to higher levels of activity with partial knee replacements.
Which is most important, getting people back to living a normal life.
Yeah, and I think, for a lot of people, a total knee replacement is a great operation, but it takes time to recover from it. Whereas, some people don't have the time to give. To get back to work,
Right.
To get back to exercise or whatever for other reasons. And so this is something that allows you to do that quicker. The other thing that's really nice about partial knee replacements that I like is that you can do them as an outpatient. So when you do it in an outpatient surgery center, patients go home the same day. The outpatient centers have a lower risk of infection than hospitals do. So that's a huge advantage
That's
there.
fascinating. You're in and out.
You're in and out. Same
Literally.
day. That's true.
Okay, so we know some of the advantages. Can you give me an idea as to what some of the disadvantages might be?
Yeah, I think there's a couple of significant disadvantages. The first is that about 10% of the surgeries, even in the best candidates, just don't work out. They go bad because the rest of the knee starts to fail sooner than you anticipate, or the operation, which can be a little tricky, it wasn't done quite right, and then the patients have persistent pain and they wind up having a repeat operation. So about 10%. And so the question comes down to, is 10% a high number in your mind, or is it a low number in your mind?
Well, what do you think? You're the doctor.
Well, I think it's very individual.
Yeah.
I have some patients who are very elderly and have a lot of significant health risks, and to go through a lesser operation makes sense to them. They know they're not going to get 100% pain relief, but they know that there's a 90% chance that this will get them back to being functional, and it's much less risky for them. Then you have a lot of younger patients for whom a total knee replacement just doesn't make sense because basically you're throwing away a significant part of the knee in a young 45, 50-year-old patient who still has 40, 50 years to live. And so this is a nice bridge procedure for that type of patient.
I think the odds are in one's favor. I think 10% isn't too bad.
I think it's a pretty good number.
Yeah.
I think it is.
Yeah. Okay, well, I appreciate this. We learned a little bit about partial knee replacement. We're going to come back and learn some more about exactly what you do here at Star Orthopedic. And Star Orthopedic's located on Bob Hope Drive here in Rancho Mirage. And do me a favor, I know you have 2 websites. Tell me the web link to the newest.
The newest website is drrajsinha.com.
Easy peasy. This is where you want to come for any of your knee replacement needs or any ortho needs for that matter.
Absolutely.
Appreciate it.
Thanks so much.
My pleasure. And we'll see you all after the break.